Center Accreditation Standards, QAI accreditation process, a step-by-step guide, and at last, a question and answer session. Overview of QAI. QAI, that is Quality and Accreditation Institute, founder and CEO is Dr. Bhupendra Kumar Rana. Dr. Rana has over 25 years of experience in quality, standard development, accreditation, and patient safety. He was the former director and CEO in charge of NABH, Quality Council of India, where his visionary leadership transformed the healthcare quality framework in the country. He's the founding member of the International Academy of Quality and Safety, IAQS, and is also the member of the Scientific Advisory Board, International Alliance of Patients Organization, IAPO. He is the vice chair elect of the Mutual Recognition Arrangement, MRA, Council of the Asia Pacific Accreditation Corporation, APAC. He was a former board member and chairman of the Accreditation Council of the International Society for Quality in Healthcare, ISQA, an international expert of the World Health Organization, the World Bank, Asian Development Bank, and the United Nations Framework Convention on Climate Change, UNFCCC. The vision of our organization is to nurture the largest global pool of organizations and people through quality improvement and accreditation framework. Our mission is to conceive and deliver education, training, and accreditation and related programs in partnership with stakeholders using an approach of co-design and co-creation. Our values are being a listener, seek continuous feedback from stakeholders to address their concerns, being competitive to look for viable options to benefit users of our services. Transparency by clearly defining policies made available in public domain, and innovation, that is, to continuously evolve using co-design and co-creation. QAI has four major verticals, that is, Center for Accreditation of Health and Social Care, CAHSC, Center for Education and Training, CET, Center for International Accreditation, CIA, and Center for Accreditation of Veterinary Facilities, CAVF. Center for Accreditation of Health and Social Care's board chairman is Professor M.C. Mishra, who was the former director of AIIMS, New Delhi. Our programs include various accreditation programs for hospitals, ART IVF centers, vision centers, dental clinics, ambulatory care, home care, patient safety WHO PSFH, emergency department, clinic, stroke center, dialysis, 7101 plus, telehealth, BMT, transition care, green healthcare facility, medical transport organization, hair transplant, hotel and homestays, and an upcoming headache clinic. QAI is the first accreditation body in India to achieve ISQA accreditation in less than 5 years of operation. It is also the first and only accreditation body in India having two standards accredited by ISQA. QAI accreditation is recognized by the Ministry of Health's Central Government Health Scheme, that is CGHS, for empanelment of private hospitals, eye centers, dental centers, and imaging centers. It is the institutional member of the International Society for Quality in Healthcare. This is the accreditation mark of QAI. Accreditation standards for dialysis centers. The accreditation process is as follows. First step is a self-assessment that is done by the organization itself. Then, application, SAT, document, and fee is provided, wherein the organization, that is QAI, reviews the registration and acknowledgement of application. The document is reviewed. Then there is an optional pre-assessment, which could be on-site, remote, or hybrid mode. Then an on-site, remote, hybrid assessment is done, after which report reviewing, including scoring and non-compliances, are done. And if the organization meets the scoring requirements, we submit a corrective action for non-compliance. A review by the accreditation committee is done afterwards, which validates the score and acceptance of corrective action. after which the accreditation certificate is being issued, which has a validity of 3 years. And within every 15 to 18 months of the accreditation, an on site, remote, or hybrid surveillance is conducted, and renewal of the application is done 6 months before the expiry. Benefits of accreditation. For patients, accreditation enhances safety and trust, as it assures that producers from stem cell collection to infusion are conducted under stringent safety protocols. Qualified professionals. Care is delivered by trained and competent staff with verified credentials. Transparency and rights. Informed consent, ethical safeguard, and patient rights are upheld at every stage. Continuity of care. Patients benefit from a well defined clinical pathway, including pre assessment and follow up, better outcomes by evidence based practices, reduce complications, and improve clinical results. For the facilities, accreditation enables the healthcare facility in demonstrating commitment to deliver quality and safe patient care. It ensures community about the quality of services and better health outcomes. It helps demonstrating that healthcare facility functions in transparent and ethical manner. It also acts as a potential mechanism of risk management to safeguard provider from potential legal liability. Accreditation is a process to stimulate continual improvement and act as a mechanism of self-regulation. It may also provide opportunity for benchmarking by comparing their outcomes with other accredited healthcare facilities. For staff of healthcare facility, accreditation process provides opportunity to staff at all levels of their professional development. It may help in building higher staff satisfaction because of good working environment, leadership opportunities, and ownership of process. Being robust documentation and procedures in place, it also supports staff in building their confidence to deliver proper care. For third parties, accreditation provides an objective system of evaluation and empanelment by third parties like insurance companies, other payers, government, etc. Accreditation helps in access to reliable and documented information on facilities, infrastructure, services, and level of care. The objective of the standard is to provide a framework for quality assurance and quality improvement, focus on patient safety and quality of patient care, set standards for quality and safety that organizations must achieve, to be revised periodically and raise the bar, and to achieve international recognition. Accreditation standards for Dialysis Center has 10 chapters, 83 standards, and 370 criteria. The first chapter is Governance and Leadership, which has 5 standards and 25 criteria. Human Resource Management has 9 standards and 35 criteria. Facility and Risk Management have 11 standards and 56 criteria. Information Management System has 7 standards and 34 criteria. Continual quality improvement have 6 standards and 25 criteria. Patient assessment and care have 16 standards and 57 criteria. Patient rights and education have 8 standards and 43 criteria. Medication management and safety have 9 standards and 42 criteria. Dialysis care and safety have 6 standards and 22 criteria. Hygiene and infection control have 6 standards and 31 criteria, making up for a total of 83 standards and 370 criteria. The standard framework can be defined as follows: a chapter which has various standards under which there are various criteria. The first standard is governance and leadership. Each center requires a governance structure that is ultimately responsible for the quality and safety of services provided. This responsibility is derived from its legal identity and operational authority for all activities undertaken by the center within the ambit of applicable laws and regulations. Each center, regardless of its complexity, also has a formal structure. Leaders ensure that a system exists that promotes safety and quality, provision of services that meet the needs of the patient, availability of adequate resources like human, financial, and physical, and monitoring and evaluation of improvement activities. The second chapter is human resource management. Human resource include all the people that work in, for, or with the center that they are integral to ensuring the delivery of quality, patient-centered, and safe care. The center must be able to assure the public or patients that it can meet their needs and deliver quality and safe care through a team of dedicated and qualified staff. The support includes the management team providing a safe physical environment for staff to work in, which is free from harassment or accidents. The third chapter is facility and risk management. The center will prevent people from receiving unsafe care and treatment and prevent avoidable harm or risk of harm. Safe, high quality care and support is intrinsically linked to how resources are used, including how they are planned, managed, and delivered. Centers must assess the risk to people's health and safety during any care or treatment and make sure staff has the skills, experience, and competence to keep patients safe. Premises and equipment must be safe and available in sufficient quantities. Good clinical and good lab practices are followed in all its operations. Centers must prevent the spread of any sort of infections. Information management system. An effective information management system is based on the information needs of the center. The system should be able to capture, transmit, store, analyze, utilize, and retrieve information as and when required for improving clinical outcomes, as well as individual and overall performance of the center. Information can be in any form, paper or electronic or a mix of both. Continual quality improvement. Quality improvement prioritize patient safety. Centers implement a patient safety improvement program to proactively identify risk and drive improvements in care quality and safety. These programs are regularly evaluated using performance indicators and benchmarked to track outcome and identify areas for improvement. Necessary actions are taken and learnings are shared internally and externally. Patient assessment and care. Patients are made aware of the services being offered through different modes. Processes are defined for various activities including registration, admission, referral, and discharge. Patients, when taken into the facility, either as an outpatient or as an inpatient, are assessed and reassessed as per policy for the clinical needs and treatment. Patient rights and education. Patient is in the center of the care being provided in a center. It is therefore important that patients' rights are documented and known to the patients. It is also important to provide education to patients related to their care. Better patient satisfaction or outcome is achieved when patients are adequately informed about their care, their rights are respected, and they are involved in the decision making process. Medication management and safety. The purpose of medication management is to provide a framework for safe and effective medication management system. Safe and effective medication management includes the process for procurement, storage, prescribing, transcribing, preparing, dispensing, and administration. All processes of the medication management of the center comply with rules and regulations of the law of land. Dialysis care and safety. It is important that the dialysis has adequate facility and knowledge to carry out various procedures which are current and based on evidence as far as possible. Different policies and procedures are required to be in place to ensure that procedures being performed provide desired outcomes and care is safe. Dialysis procedures adhere to best practices. Hygiene and infection control. Changing technology and disease profile continue to prevent new challenges for infection prevention and control within healthcare centers. Patients are at risk of developing healthcare associated infections because of decreased immunity among patients. The increasing variety of medical procedures and invasive techniques creating potential routes of infection and the transmission of drug resistant bacteria among crowded center populations with poor infection control practice. Healthcare associated infections are amongst the most common complications affecting patients. QAI also provides support for trainings on accreditation standards, DIVE, that is Documentation, Implementation, Verification, Elevation program, which is designed to help staff in understanding of standards and its implementation and verification through, and also helps in internal audit as well as self-assessment. Thank you so much. For further query, you can contact or visit our website, that is www.qai.org.in or info@qai.org.in. Thank you so much. So if anyone has any query, please feel free to ask now.